Okay, good evening, AMPers. Going to knock out, Dr. O here, going to knock out a comprehensive review of the cardiovascular system, which is comprised of blood, heart, and circulation. All right? So I'm going to do my absolute best here to give you guys the meat and potatoes, the take home message, if you will, the big picture on this content, and try to leave out any of the minutiae that perhaps is not clinically relevant or is beyond the scope of our studies. Here goes. Okay. Blood. It's been around for a very long time. Hey, it flows within us. We've got, there are many statements that you can see here, such as can't get blood from a stone, blood, sweat, and tears, what have you. The Greeks regarded blood as the seat of the soul. We talked about the four humors. Humors are something that flow. So blood is very important in that it has life-giving properties. We're going to discuss various functions of blood. All right. Blood helps us breathe. How? Hemoglobin with oxygen on board, right? Helps us perform gas exchange. Nutrition. When we break down our food items after a nice meal, we break them down into the building blocks of those macronutrients, so proteins, carbs, and fats, vitamins, minerals, trace elements that are going to be diluted into the blood and carried every which way to the far reaches of our fingers and toes and everything in between there. All right? So that our cells can use those raw materials to live. Blood also carries and brings away wastes. Once those cells have used those items, there's always going to be some sort of waste products that we need to eliminate. Thermoregulation. Blood keeps us warm, and blood also is going to help us wick away sweat in the form of exercise as the blood exits the body via, or is evaporated off. Fluid is evaporated off the body cells when we exercise. We'll sweat, called the sweat mechanism. There's something that accomplishes that. It's called the sudoriferous gland, rather. The blood also carries white blood cells, and they are like little Pac-Man cells that destroy all foreign matter, bacteria, what have you. So in as much as that, we've got the immune system at work with the white blood cells. The chemical acid-base balance of the body is also facilitated by the blood. It's a primary function. Water is balanced, and communication is made possible via the blood. More than anything else, blood connects things. All of the cells, tissues, organs, and systems throughout your body, they function on their own and also are interrelated. And so the substance that connects all of these structures, that brings the nutrients, that carries away the wastes, that facilitates the function overall, comprehensively in our organism, is blood. We have a given quantity within our bodies based upon our gender or size. It's between 4.5 and 5 liters of blood is circulating within us right now. Right? And blood is regulated by the kidneys. On blood volume, I remember I mentioned that in the Franklin Institute, there's like a scale that you can stand on, and that measures your mass, essentially your weight, and then it backs into the machine backs into exactly how much blood you have in your body. So, got a 50-pound child stand on the scale, it's going to be this much blood, and then when I get on there, it goes off the charts, right? Because we got a lot of blood. The bigger we are, the more we use our body, the more blood we need to circulate in order to service all of that anatomy. So know the primary functions of blood. Understand that there are two components of blood. They are plasma and the formed elements. The formed elements are essentially the cells, and the plasma is the fluid. And there are some dissolved substances within the fluid that are equally important as the water itself. Here's a vial of blood that we might take in a clinical setting, in a lab, and you can see we spin it in a centrifuge, and all the formed elements are going to separate out from the plasma. The plasma is a straw, colored substance there, almost looks a bit like urine, and it's got some substances dissolved, such as albumins and globulins and fibrinogen, that serve various functions unto themselves. You are also going to have the white blood cells, which look like a tiny layer, like a little waxy layer, which is right here. And then the platelets are also sandwiched in there. And at the very bottom, we've got the heaviest component and the most abundant component of the blood, which is the red blood cell, or the erythrocyte, the red cell. Okay. And here's a peripheral smear, as they call it, of the formed elements. We've got the white blood cells, various white blood cells, and platelets are the little chunks of things in there, and then the little red donuts that are the very abundant erythrocytes. You need to be able to identify them and understand their function. Name the structure, name the function. So describe the composition of blood. Consists of plasma and formed elements. Taking a look at the red blood cell, again, it's like a red donut, or that inner tube that I brought into lecture there. They're otherwise known as erythrocytes, or an RBC, red blood cell. There's a lot of them. All right? They are biconcave or donut shaped because the nucleus and many of the other organelles have popped out during the maturation phase. So rather than having all of that machinery, such as the endoplasmic reticulum and the nucleus and the Golgi and all that stuff, it has hemoglobin. So imagine a hemoglobin sitting in an inner tube at some water park or something, and you've got the red blood cell. The primary component is that hemoglobin, which facilitates oxygen, the carrying of oxygen and carbon dioxide. So remember that it does both of those things. I like to think of hemoglobin as kind of a taxi, all right, that picks up oxygen and drops it off, and carbon dioxide. So oxygen gets in the cab, and it's transported to various locations throughout the body, and oxygen will hop off. When hemoglobin is carrying oxygen, it is called oxyhemoglobin. And here's the molecule itself. There are 300 molecules of hemoglobin on every single red blood cell. And there's a slightly larger hemoglobin, or significantly larger hemoglobin concentration in males. We have more lean muscle mass typically, so there's enhanced ability to carry oxygen, a greater need for more circulation of red blood cells. If somebody has a condition called anemia, it means that there's a decrease in red blood cells, and therefore we can assume that there's going to be a corresponding decrease in hemoglobin, which is going to impair oxygenation of tissues. So that person's cells are not breathing well. Another slide talking about the correlation of red blood cells and hemoglobin. When we've got normal red blood cells over here, that's cool. All right, we've got an adequate tissue oxygenation. An anemic patient's going to have less red blood cells, so a decrease in red blood cells, and therefore a decreased ability to carry oxygen. Less oxyhemoglobin, cells can't breathe, they turn blue, tissue dies. It's not a good situation. Another condition, a little less rare than anemia, is called polycythemia, where there's a tremendous increase in the production of formed elements, and that can cause problems of its own. I will not expect you to know these particular values here. Just know that there's a lot of red blood cells, more in men than women, and that red blood cells carry hemoglobin and oxygen, also carbon dioxide. So what is the oxygen-carrying protein within the red blood cell? Hemoglobin. And hemoglobin concentration is directly in proportion to the number of red blood cells. Blood is produced in a process called hemopoiesis, and that happens in the red bone marrow for the most part. Okay, there are different, during the course of development from a fetus onward, the liver and other organs can play a significant role, but in the adult, red blood cell or formed element production happens in the bone marrow. That's another very important function and underappreciated function of the long bones of the body, because that's where the majority of this happens. Long bones such as the femur, the humerus, all the long bones in the body. And here you can see the process of maturation from a stem cell, which is essentially a blank slate cell that can be activated and turned into any other cell, a skin cell, a liver cell, a brain cell, a neuron, right? Depending upon the receptor that activates it. All right, the receptor, in this case, turns on the hemopoiesis or red blood cell production, and this is how the whole thing happens. Sorry, not red blood cell, but formed element production. So, red blood cells, white blood cells, platelets. Here's some more elaboration on hemopoiesis, or the production of formed elements. Two different types. There's myeloid and lymphoid hemopoiesis. The stem cell that is going to transform into these different formed elements is called a hemocytoblast. Erythropoiesis specifically, erythro means red, right? So the red blood cell formation, here's that process here, multiple stages. Most important thing that I want you to know is that it starts with a stem cell, and across the course of that maturation, the red blood cell will lose, or that stem cell will lose its organelles, including its nucleus, and iron will be added, and then you've got red blood cell carrying hemoglobin, and that's how it all happens there. There are 200 billion red blood cells created and destroyed per day. Very important that happens. Red blood cells are going to live about 120 days max. And when these red blood cells grow old and ultimately die, their products are recycled. Nothing is left to waste. So the proteins, the iron, all that is going to be recycled so the process can continue. Hormones control everything, right? Nerves and hormones, so the neuroendocrine system. The liver is going to produce, regarding red blood cell production, the liver is going to produce a hormone called EPO, or erythropoietin. And erythropoietin, remember I mentioned cyclists and other endurance athletes like to dope with it so that they can increase their endurance and their body's ability to carry oxygen. So more red blood cell production, more oxygen, can train longer, ride their bikes faster. This is produced by the liver, EPO, and then it's going to be released and regulated by the kidneys. If we got low red blood cell production, low hemoglobin, our body is undergoing some sort of stress, EPO will be produced by the liver and dropped off, activated by the kidneys, and the machinery starts up. The manufacturing plant of red blood cells begins within the long bones. So the primary source of erythropoiesis in the adult happens in the red bone marrow. White blood cells. These are the immune cells of the body, and they are also produced within the bone marrow. There are less of these white blood cells in circulation, but you can think of them like an army that takes a field of battle, and they're looking for foreign bodies, different antigens, things that they need. The body will hurt the body, so they maintain homeostasis by launching attacks on things like bacteria and other substances that we need to get expel from the body. You could think of them, at least some of them have this capability of to their phages. They eat foreign materials and bacteria, for instance. So that's one of their functions. They serve kind of like a Pac-Man. Two types, there's granulocytes and agranulocytes. Remember that the granulocytes look like they have little rocks or pebbles within the cytoplasm. And those are lysosomes, like these little bags of poison that they're going to like they're going to throw like hand grenades at things like bacteria, etc. Neutrophils are the most abundant of the white blood cells. These are white blood cells, I'm sorry, I didn't fail to mention. Collectively they're called leukocytes. So erythrocytes are red blood cells, white blood cells are leukocytes. Neutrophils are very abundant of the white blood cells. They're 65%. So the vast majority of white blood cells, if you see one under a microscope, odds are it's going to be a neutrophil, right? They're very mobile. They like to move around. They are phagocytic, so they like to eat bad guys, chew things up, and spit them out. They contain those lysosomes, as I said, are kind of like hand grenades of poison. Eosinophils, 2 to 5% of the white blood cells within a typical specimen. They'll chew things up and spit them out sometimes, but their weapon of choice are these granulocytes. So these reddish hand grenades in there. They will link to a bacteria, let's say, and they will pass them a hand grenade, and that will trigger an explosion essentially in the bacteria, and maybe they'll take a bite out of them. They're very prominent, eosinophils, in allergic reactions, as are basophils. And basophils, there's even less of them, but they're badasses. So maybe 1% of circulating white blood cells are these basophils. They look blue. So when you think basophil, you think blue. They're active in allergic reactions. And their granules, their hand grenades, are comprised of histamine and heparin. So these are two potent chemicals that help us respond to infections and allergic reaction. Inflammation. Lymphocytes. Next to neutrophils, there are a lot of lymphocytes. So it's neutrophils, lymphocytes, eosinophils, basophils, so far, right? And lymphocytes are small, and they've got a very high nucleus to cytoplasm ratio. So you'll see a real big nucleus inside a smaller cell, and then you'll see maybe a little crescent of cytoplasm. So lymphocytes are abundant, 25% of white blood cells. There are two types of lymphocytes. There's the T lymphocytes and B lymphocytes. So the T lymphocytes are berserkers. They go on like direct attack missions against foreign invaders. The B lymphocytes, their weapon of choice is they produce like antidotes, and these are called antibodies. So an antibody is essentially a chain reaction. It is a chemical substance that they will get circulating, and it like spreads the word to all of the cells in that area, to other white blood cells and whatever tissue it's in. Hey, we've got bacteria that are invading. We've got an infection. We've got inflammation. So we need to act quick or we're going to get overwhelmed. The T and B lymphocytes. T, they're direct attack missions, berserkers. B lymphocytes, whisper down the lane. They spread the word. Monocytes, they're real big, and they like to chew things up and spit them out. So in that way, they're very highly phagocytic. They eat things. They've got some vesicles, some little hand grenades, but they like to chew on things mainly. So if you ever see a big white blood cell, that's a monocyte, and monocytes typically turn into macrophages. You need a certain level, certain quantity of white blood cells in your body. In the case of if you don't have enough white blood cells, then you're kind of screwed because you don't have any immune system. You have no way to fight off disease. If you have too many or an elevated white blood cell count, you may have an infection. You could have a condition called leukemia, where the white blood cells actually, there's so many of them hanging out ready for battle that they start attacking friendly cells. That's not good. Making of the white blood cell is called leukopoiesis, where, remember, erythropoiesis was red blood cells. Very similarly, you've got a stem cell that's going to complete various stages, and depending upon the hormone receptor that is active, that's going to dictate whether white blood cell becomes a neutrophil or a basophil or eosinophil or a monocyte. That's all dictated by those hormones. So stem cell, blank slate, turns into a formed element based upon those receptors. General function of leukocytes, they are warriors. They like to destroy bad guys. They comprise our defenses. When the white blood cells or leukocytes take the battlefield, they're going to destroy. And there are different types of warriors on the battlefield. Some are cavalry, some are foot soldiers, some all that stuff. Drive tanks, these guys like to chew on things and spit them out. They like to throw poison hand grenades. They like to spread the word to all of the other friendly warrior cells that, hey, we got to go get them, right? So the largest, smallest, and most abundant white blood cells, the largest white blood cell is going to be the monocyte, which turns into a Pac-Man, a macrophage. The smallest is the lymphocyte, and there are T and B lymphocytes. The most abundant white blood cell is the neutrophil, then the lymphocyte, then the monocyte, the eosinophil, and the basophil. Boom. Platelets. These are really active in clotting. So when you ever hear a platelet, you're going to know a platelet as a thrombocyte, and you need to have a certain amount of these, certain platelet count, quote unquote. That's the phrasing they use. And if your platelets are low, then you're going to bleed, and that's never good. We need to clot effectively. Platelets, hey, they have different properties that'll make them effective. Here we've got a picture of red blood cells in an injury, in let's say a cut, and we've got little fibers and chunks of things that they're the equivalent of throwing sandbags into a break in a dam. All right, the dam is breaking. We need to clot this area. We need to throw some sandbags. Everybody get to work. The thrombocytes, they stick together, and that's called agglutination and adhesiveness. And they like to collect. So they like to hang out together. They clump, they stick together, and they stick to other cells, shoring up the dam. Here's another example of an injury. It's called hemostasis, is when we stop the bleeding. So whenever there is an injury to the body, we need to stop that. Stasis means stop. And hemo means blood. So stop the bleeding. To coagulate is, that's part of the process of the clotting. Another word for clotting. Platelets also will fend off bacteria. Well, because there's a lot, if we look up here, there's an awful lot of bacteria that are hanging out trying to get inside the body. And we know that the skin is a barrier, like a suit of armor protecting these guys from getting in. So the platelets, of course, by closing up the space where the bacteria could get in, they also have a secondary antibacterial function. Platelets, hey, a big parent cell, a stem cell called a megakaryocyte, is going to break up into tiny pieces. And those little pieces look like maybe like apple seeds or something. There they are. And they're going to spit them out, and they'll get in circulation. And should there be an injury, a cut, or loss of blood, these thrombocytes are going to go directly to that area, and like many sandbags, they're going to throw themselves into the dam. The hormone that controls platelet production is called thrombopoietin. Remember, thrombo means platelet. Process of forming a clot. The skin is broken, let's say, or that tissue, there's an injury in a particular area of tissue. Red blood cells are going to go to that area. They're going to get stuck in there. They're going to release different proteins that are going to be like sticks and branches and stuff, the equivalent of that. Those proteins and the thrombocytes are going to go in the area. The platelets stick together. They clump. They hang out in that area. And it's going to form a physical barrier. And that barrier is also going to be secreting or squirting out chemicals, almost like you would pour concrete into that area. There are chemicals that the clot itself are going to release that's going to be like concrete. And when the concrete sets, the skin heals over, it remodels the area with things like collagen, and the skin will be good as new. Platelet structure and function. Thrombocytes produced by thrombopoiesis. The hormone that's active is thrombopoietin. Right? They begin as a megakaryocyte, which breaks up into these little chunks. And those little chunks are called thrombocytes. And they're going to help things clot. Boom. Hey, blood flows, it connects things, it performs a great many functions, all of which you need to be familiar with. Your patients are depending upon that. There's plasma and formed elements, very, very important in the maintenance of homeostasis, constant internal balance. How do we pump it? With the heart. All right, so here we go. Heart is going to be a fist-shaped organ in the mediastinum area, biased left, so a little bit to the left of your sternum, substernally. You can palpate the heart. You can feel its activity by walking your fingers in between your ribs as you go down, maybe the fifth and sixth intercostal space between the ribs. You can feel it via the pulses. You know what your heart's doing by feeling the pulse at your wrist, called the radial pulse, or your carotid pulse, or so many different pulses throughout your body. Really important stuff. But hey, lots of things circulate. Circulate to percolate. We've got money in circulation. We all want it. We've got the weather, circulation of winds and waves and clouds and rain, storms and all that. We've got magazines in circulation. Well, blood circulates too. It connects things, maintains homeostasis. The heart's got to pump it. It pumps it down these various pathways called blood vessels, arteries and veins. We're going to get into them. The smallest blood vessel within the body is called a capillary. And what is going to dictate the blood getting to your fingers and toes and to every cell, tissue, organ system in the body is the pressure. The pressure that is created by the heart, the pressure that is facilitated by these different dimensions of arteries. Right? And these structures are capable of dilation or opening wide, or constricting, really thinning out, so they can change the flow of blood. And here are the blood vessels. The red artery and the blue vein. Arteries are going to always be depicted as red. They carry oxygenated blood. Veins are going to be carrying mostly deoxygenated blood, so the oxygen has jumped out, squeezed through the walls of the blood vessels, and performed its function, dropped off its nutrients, dropped off the oxygen, picked up some wastes, done all the heat exchange and pH balance, etc. And now it's getting back into the blood, returning to the heart so that it can be pumped to the lungs and reoxygenated, and the whole process is completed. So we've got arteries, veins, capillaries, and anastomoses, which is this right here. The anastomosis, I gave you the analogy, it's like you clasp your fingers together, and that is the interplay between the the arteries and the veins kind of interact there on a very small microscopic level. The pathway of blood, we're going to talk in detail about that, but there's a circuit. All right? Blood's got to be moving around the body, so there's a very efficient way that between the heart and the circulation, the blood is able to get around and perform its functions. There are two circuits by which blood flows, the pulmonary and systemic. Pulmonary, you're always going to be thinking about the lungs and oxygenation. Systemic is the system, the entire body. That's when blood flows to the entire body. Okay. The pericardium is very important. Its primary function is to contain the heart within the mediastinum and, most importantly, reduce friction. So when the heart beats so frantically, 60 to 100 beats per minute, however many thousand beats per day, per month, per year, and depending upon our activity, are we just at rest, or are we exercising, are we stressed out, the heart beats accordingly so that it can pump more or less blood, right? So it creates a lot of heat, just like if you were to do a workout, you would be really, really hot, you'd be sweating, you could eventually wear yourself out quite a bit due to the activity that you're engaged in. So the heart never gets a rest. And the pericardium has 3 layers. All right? There's the visceral pericardium, which is right on the surface of the heart itself, a little shiny layer. And then that's called the visceral pericardium. Then the parietal pericardium is the layer on the outside of the heart that actually looks like a bag, like a little plastic bag. And then between those 2 layers, the visceral and the parietal pericardium, you have the pericardial cavity. And this is a very, very thin space where there's not a lot of room, and all there is fluid. And it's a serous fluid that is going to help reduce friction so that the heart can beat without any heat. Tremendous heat anyway, without overheating. Blood vessels. Blood vessels consist of arteries, veins, capillaries, different size, different construction. We look over here on the left, there are 3 layers of both arteries and veins, and we're looking at larger structures. So right here in the center, rather, you'll see that on the bottom left we've got an artery, a muscular artery, which has a very distinct opening. Looks like an O, right? And then the vein is over here, looks kind of floppy. So you can histologically, when we look through a microscope, we can tell the difference very easily between an artery and a vein. And what makes an artery especially effective is that it's got this muscular layer in the center. So it's got an inner layer that's really smooth that helps blood flow very smoothly. It's got a middle layer that helps the blood the blood vessel change dimensions, so it can constrict or become narrow, and it can dilate, become wider, depending upon what the body's trying to do. Right? And we've got this tough outer layer. It's kind of like the outside of a garden hose, which maintains the outer integrity of the vessel. Whereas veins are kind of floppy. Those 3 layers are called tunics, right? We've got the tunica externa, media, and interna. And those are you can take tunic as a layer. Right? So the outer covering the inner layer, which is mostly muscle, smooth muscle, which lines hollow organs, right? And then the interna, a couple layers thick of squamous epithelium, simple squamous epithelium. The heart wall, the heart itself has several layers, just like the blood vessels. So it's got an outer layer that's pretty tough, comprised of connective tissue, some fat to help insulate the heart. And then it's got the myocardium, which is the heart muscle itself. And that's the bulk of the heart. It's like a big muscle. And the type of muscle in the heart is cardiac muscle, of course. It's got multiple nuclei. It's got branching of the fibers. Kind of looks shredded, wheat look to it, I think. It also has these connections called intercalated discs, which are these little like electrical plugs that connect all the muscles to one another so that they beat as one beat, very coordinated, right? In a coordinated fashion. And then the inner layer of the heart wall is the trabeculae carnae, the endocardium. Endo means in. So the inside layer of that heart is going to be smooth, once again, because we need to encourage the blood to flow. We don't need any obstructions or anything like that. So the epicardium is on the outside, the myocardium, and the endocardium, 3 layers of the heart. The different layers of the heart and the blood vessels as well, the tunics, 4 heart chambers, 2 atria which receive blood, and 2 ventricles which are going to be the powerhouses of the heart, and they're down below. So left and right atria, left and right ventricles with this muscular septum between them called the interventricular septum. Essentially, you can take a heart and cut it into 4 quadrants, and that's what we're talking about right there. There are valves that are going to attack, or they're going to connect the atria above with the below ventricles. And those valves are going to be operational by pressure. The blood pressure is going to force them open or closed. Know the 3 layers of the blood vessels and the heart, and also know the 4 chambers. The 3 layers of the blood vessel, or the tunica intima, the inner smooth layer, maybe a couple cells thick, squamous epithelium. The tunica media, which is smooth muscle, help the vessels constrict and dilate. And the tunica externa, which is a tough outer connective tissue fibrous, connective tissue layer, kind of like the outside of a garden hose. The 3 layers of the heart, the epicardium, or let's go medial to lateral, deep to superficial. It's thinking endocardium, smooth inner aspect. Myocardium is the muscle itself, cardiac muscle, and the epicardium is the connective tissue on the outside. 4 chambers, atria, left and right, ventricles, left and right, connected by atrioventricular valves. Here are the valves again. The atrioventricular valves previously mentioned connect those 4 chambers, right? Left and right, right atrium, atrioventricular valve, right ventricle, left atrium, connected with a left atrioventricular valve to the left ventricle. There's some common names for these AV valves. So the right AV valve is otherwise known as a tricuspid. It's got 3 valve leaflets that attach. And the left atrium, the left AV valve, is otherwise called the bicuspid or the mitral valve, just to confuse you guys. Right? Some functions, some structures of these valves. There's valve leaflets. That's what makes it, or cusps. That's what makes it a tricuspid or bicuspid. And there are these little parachute strings that you can see here called the chordae tendineae. And then there are the papillary muscles, which the chordae tendineae attach to. And those muscles will contract and pull on the chordae tendineae and ultimately open the valves, pull on the leaflet, open the valves. Arteries and arterioles are different gauges of these blood vessels. Okay, so an artery is going to carry oxygenated blood. It's going to have a lot of muscle that's going to allow the diameter or the cross section of that hole, the lumen, the opening of the blood vessel. It's going to allow it to open. It's called dilation. Constrict is going to be when it squeezes. And blood flow is going to change as a result of that dilation and constriction. An arteriole is a very small artery. And there again was the anastomoses, the connection of the arteries and veins. Following the pathway of blood within the heart, there are many, many good illustrations here. And you're going to have to tap into those and just memorize the flow of the blood from the right atrium into the right ventricle, through the pulmonary trunk to the pulmonary, into the pulmonary arteries, and route to the lungs. Gas exchange, oxygen hops on, carbon dioxide hops off when we exhale, and that oxygenated blood is going to be dumped into the left atrium and then be dumped. Pressure is going to accumulate in the left atrium and push it, the AV valve, open on the left, called the mitral valve. The left ventricle fills up, glug, 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 glug. Pressure builds up. It's going to force the aortic valve up, and that huge thumb thickness, biggest artery in the body, is going to explode with a torrent of blood that's going to go out to the systemic circulation. So be able to follow these. Here are the various steps right here. Know it, make it your own. Capillaries, very, very small, smallest blood vessels in the body. They're 1 cell thick. So when I say that, I mean that a stack of red blood cells will typically be seen in there like they're waiting in line, and they need to be flowing very seamlessly. Can't afford any traffic jams, or the blood will not get to its destination. The heart needs a blood supply itself, and those are called the coronary arteries. So these little rivers of arteries are going to be coming off the aorta. So this aortic arch right here, there's going to be little branches. The pressure of the heart beating is going to push blood into the coronary circulation, which is going to make sure the heart muscle has all the nutrients and oxygen and waste removal that it can possibly have, so that it can function, perform its nonstop activity. Somebody has a coronary, that's short for heart attack. That's not good. That part of the heart will suffer, struggle, and perhaps die, and that can oftentimes mean death. Different types of capillaries. So these 1 cell thick blood vessels, some of them are continuous, some of them have fenestrations. These fenestrations are these little openings, these little holes, little trap doors throughout the length of the capillary, where blood vessels, or not blood vessels, red blood cells, platelets, the formed elements can just hop off. So if I want to go over here and stop at the liver, and I'm a red blood cell, I can just sneak out one of these fenestrations. Or if I'm a platelet and there's a cut over here, I'll go over here and squeeze myself into that cut and block it out with my thrombocytes, right? So that's the purpose of fenestrations. Very, very important function that they play, because blood, it flows down these vessels, but it also needs to get out along the way. It's like you're taking the train down to Philly, and you can stop at any of these different stations. Those stations along the way are fenestrations. I want you to know that the coronary circulation, or the blood, the arteries that feed the heart itself, they function best between beats. So we've got systole, which is a contraction of the heart, and diastole is the relaxation of the heart. And when, in that instant, after the heart contracts and it finally relaxes, that is when the coronary circulation is facilitated. That's when blood flow is the best to the heart. And that's what that graph dictates there. Capillary networks, here we've got a great electron microscopy image of just a crazy spider web looking structure, different densities of capillaries. I mentioned the dude who will take this plastic material and force it into the circulation, and then it gets into capillaries, and then all the tissue, they take the tissue off, and all that are left are the capillaries and the different gauges of blood vessels. And so with any living organism that requires circulation, any mammal, you can do that. They'll dye these capillaries red, and it'll look like a little rabbit or a human being playing basketball or whatever. Capillaries are very, very important. Remember, we did that test in lecture called the capillary refill, where you press down on your fingernail or your toenail, press into the skin in the farthest reaches of your body, your extremities. This is where it's very difficult, in the case of disease processes such as diabetes, for the circulation to get. Oh, I have bad circulation. Well, that individual is going to have very poor amounts of capillaries. These capillary networks will not be as rich as somebody who exercises, takes care of themselves. Yes? Tracing a red blood cell through the heart, know it. And the heart's blood supply is called the coronary circulation, and it is best during diastole. Veins have valves. I want you to know that. That is what is going to drive between muscular action, our mobility, our moving around, squeezing blood up these veins, let's say in our legs, in our feet, to our calf, into our knee, into our thigh, into our butt, and all the way up our trunk into the right atrium. That happens due to muscular action and various aspects of respiration, our breathing, and most importantly, these valves. They're one-way valves that will not allow backflow. And when these valves become incompetent, in other words, they stop working, they call that a varicose vein. Nerve supply to the heart. It receives both sympathetic and parasympathetic power. All right? So remember the autonomic nervous system and where that lives. Here we've got some wires that are coming from the thoracic spinal cord segments as well as the brain stem. Sympathetic and parasympathetic input. So sympathetic is fight or flight. It's going to make the heart go lub dub, lub dub, lub dub. And it's going to make your heart race. And then the parasympathetic is trying to calm the heart down. Lub dub, lub dub. All right, so it's like an angel and a devil, or whatever sort of balance, a seesaw model. There is dual innervation from the autonomic nervous system. There are also some, within the brainstem, there are cardiac and respiratory centers. Remember we talked about in AMP1 that the brainstem has a lot of these switches, these really, really important reflex centers, the cardiac center, the respiratory centers, and if the brainstem should be compromised, it's never ever good. Blood flow pressure and resistance. Okay, what's up with that? The dimension of the blood vessel. As the heart pumps blood into the large arteries and they get progressively smaller, think about all that blood driving down a 4-lane highway, which is a large or medium-sized artery, and then progressively getting onto these smaller back roads. Those back roads are going to be the capillaries, and there becomes a bottleneck, a back up, and that forms pressure. That creates a pressure, and that pressure that is created is called resistance. And that's really, really important for the circuit to complete, the pulmonary and systemic circuits. It needs that pressure, needs blood vessels of various diameters and elasticity. Cardiac physiology. The cardiovascular system, as stated, we talked about the most important aspects of blood. It transports, it connects things, so blood needs to flow at all times. When blood flow is good, health is typically optimal. So that's why exercise is helpful, because it facilitates an efficient heart and circulation. Perfusion. If you were to press into your thumbnail and the color the thumb would blanch, you're pushing the blood out of the capillaries and then watching how fast it returns. That means you have adequate perfusion if the blood returns quickly. And if the blood were to be delayed due to disease process or inadequate circulation, that's going to cause a problem. Here we have an illustration that talks a lot again about, provides an analogy about a 4-lane highway right here versus then we've got a construction ahead, which is this vise, and that's going to pose a problem. That's going to create resistance, going to create a backup right here, a traffic jam here, and everything beyond that traffic jam is going to be, the pressure is going to be good. So we need adequate blood flow. Depending upon your activity, there's going to be, the heart rate's going to increase, right? When we are performing a physical task, you can feel your heart beating rapidly within your chest. That's going to increase the pressure within the system so that we can do more work, deliver more nutrients and oxygen, remove more wastes. When we do more work, the cardiovascular system has to step up its game. When somebody becomes disease process attacks the cardiovascular system, or it becomes inefficient, it will struggle to perform all these functions and ultimately can break down on us. Blood pressure is how much between the amount that the blood that the heart is pumping, the strength of the heart's contraction, and the health of the arteries and the blood vessels is going to create a blood pressure that we can test. Normal values is going to be 120/80. The range is 90/60 on the low side, and 140/90 as high normal. So 120/80 would be ideal. Heart pumps things, and it needs a control system. It needs to be plugged in. It's plugged in with this modified cardiac muscle network that you can see here in yellow. And the SA node, or the sinoatrial node, is known as the heart's pacemaker. It will communicate to something called the AV node, and the AV node will trickle down to these little branches you see below here, and that are called the bundle of His and the Purkinje fibers, that are like wires that are plugged into the framework of the heart. Make sure that it pumps predictably, efficiently. This is the heart's electrical system. Here we're measuring blood pressure. We do that with a sphygmomanometer. Say that 3 times fast. We're going to apply some pressure via this bulb, take a pulse, and listen to it with our what the hell is this thing? Having a little brain fart here. Stethoscope. Put the stethoscope on the brachial pulse. Occlude the artery with the sphygmomanometer, creating pressure ultimately squeezing off the artery till the blood flow stops, and we're gonna determine that pressure. Hopefully it's 120, and we let the air out of that cuff. It's going to trickle down when we no longer hear the beat in our stethoscope, and we're looking at the dial, and that stops. Hey, we've got a normal diastolic reading that's going to be 80, 120 over 80. We're going to show you guys how to take blood pressure in lab and in many other classes. Talked about the pacemaker of the heart, the sinuatrial node. Here you see it on the top left, firing, and it's going to hop over to the next little nodule there called the AV node, and then down this network and into each ventricle. You got high blood pressure, it's called hypertension. You have low blood pressure, it's called hypotension. So hyper is an increase, hypo is a decrease in blood pressure. It's normal for blood pressure and pulse volume to increase a little bit as we age, because the heart will lose some efficiency. It can. And the blood vessels absolutely lose elasticity. So the cardiovascular system's going to have to work harder. Here is the sequence of cardiac stimulation, really broken down well. SA node to AV node to bundle branches and Purkinje fibers. These are the things that determine resistance. Here we've got the heart in the center, pumps blood into the pulmonary and systemic circuits. The thickness of the blood, or how the viscosity of it, the length of the blood vessels that blood has to be pumped down, and the thickness of, or radius, diameter of each of those arteries and veins is also going to determine how much resistance there is. Remember my analogy between the 4-lane highway going down to 1 or 2 lanes. There's going to be a pressure that will be created here at this bottleneck. What's the name of the neurological structure within the heart that regulates the pace? The pacemaker of the heart is the sinuatrial node. Here is a capillary with red blood cells all in line, like ducks in a line, heading to their destination. An EKG is going to tell us how well the heart is functioning electrically. Another good illustration on the cardiac cycle. Know that the heart and circulation are controlled by the autonomic nervous system, also the neurological and endocrine systems. The neuroendocrine system is going to work together to ensure that the heart is going to be beating effectively and pumping adequately. There's going to be local control, neural control, and also some hormones. The neuroendocrine system. That's all laid out here pretty well. Know that in order for the ventricles to pump powerfully, they need to be filled. And those muscles, the ventricles, they need to be flexible. So they need to be able to fill up all the way to the brim in order to generate the pressure to pump well. Heart sounds like lub-dub. That correlates with the sounds S1 and S2 that we listen to via stethoscope on the chest. The sounds are produced by the closing of valves. What force is responsible for the operation of the valves? Pressure gradients. Capillary exchange, again, we're talking about fenestrated capillaries, the little trap doors that the formed elements can hop out of the pool and go drop off nutrients and oxygen, pick up wastes. Cardiac output means how much blood we can eject times how many beats per minute. So when the heart beats, lub-dub, how much blood is it able to eject, and times the number of heartbeats per minute. Starling's law is about flexibility. A flexible muscle is more able to contract. So just what I talked about before with the ventricles that are flexible can fill up all the way, and then they can generate power, ejecting a lot of blood. The ejection fraction is how much blood can be expelled per beat. If you don't have enough circulation, you can go into something called circulatory shock. This is true. How does blood return to the heart? There are one-way valves. Pressure also drives it back to the heart, but gravity is fighting that. When we breathe, we create something called a thoracic pump, which is going to create a suction and encourage the return of blood to the heart. The heart itself can have a sucking action called cardiac suction that will also send the blood back to the heart. But I want you to remember, here we've got a picture of somebody doing a calf raise, as in walking, as in standing. We need an object in motion stays in motion. So there's the deep leg vein in blue. Got one-way valves. When the blood passes the one-way valves, it's like an elevator going up. And if those valves if they crap out, they become incompetent valves or varicose veins, then the blood will pool in the lower legs. And you'll have a condition called edema, swelling. You got to stay active. If you stay active, your cardiovascular system will be able to perform its function. Resting heart rate, 60 to 100 beats per minute. You can palpate it on the radial pulse. You can palpate it on the tibial pulse. You can palpate it on the popliteal pulse. Any of these regions where the blood vessels are going to pass through, and you can access with your fingers, you can determine the pulse rate. Pulse rate's going to increase in people who are sedentary, people who have hypertension, high blood pressure. In well-conditioned athletes, the blood pressure, and smaller people, the pulse rate can be less on the lower side. What affects heart rate? Exercise can make the heart rate go down in a good way. Changes in blood pressure will make the heart work more, therefore it's got to beat faster. Blood's got to flow faster. If you're stressed out, riled up, the blood pressure and the heart rate are going to increase. Different types of circulatory shock. Hypovolemic shock, for instance, there's not enough volume in order to complete the circuit, for the circulatory system to work efficiently. So if there's not enough volume, you're not going to be able to deliver all the things and pick up wastes, and so on and so forth. Why would there be a decrease in volume, blood volume? Maybe the person's losing blood. Maybe they got internal bleeding. Maybe they have a gunshot wound, right? Another real close image of venous return to the heart. Geez. Onward and upward here. The cardiovascular system overview. Heart and blood vessels. We talked about blood. Blood flows. The heart pumps it. The circulation carries it through these various pathways, arteries and veins, and arterioles and venules, and anastomosis of those blood vessels. Blood vessels range from large to small. Two divisions of the cardiovascular system, pulmonary and systemic. Heart shape, fist-sized in the mediastinum, surrounded by the pericardium, between the lungs. Check this out. Here's that plastination, this process that's really cool. All the tissue, they take the tissue away, just leave the blood vessels, and those are all those little pathways that are leading all the way to your wrist and hand and fingers. Very, very cool. Remember, blood transports and connects things. You've got plasma-informed elements. You've got erythrocytes, or red blood cells. White blood cells are leukocytes. There are different types. The most abundant white blood cell are going to be neutrophils, and then it's lymphocytes, and then it's eosinophils and monocytes and basophils. White blood cells are warriors. They are the immune system. They fend off bad guys and gals. They're Pac-Man cells. They like to eat things. Right? They like to throw little poison grenades at bacteria and destroy them. Right? B cells and T cells. T cells, direct attack missions. These are white blood cells that like to fight. B cells like to spread the word. Hey, we got a battle over here. Let's go kill everybody. Right? Red blood cells and white blood cells, platelets, they all start with a parent cell, a blank slate, a stem cell that is going to be transformed into one of those structures, one of those cells, based upon receptors, hormone receptors. A specific receptor is going to turn that stem cell into a red blood cell that's going to carry oxygen and nutrients. And another hormone receptor is going to turn into a white blood cell. Another a platelet. Right? The straw-colored plasma has little substances dissolved within it that also are chemical compounds that will help with clotting, that will help maintain pressure, osmotic pressure within the fluid, so fluid pressure. They also can help mediate inflammatory reactions. Resistance is created by the power of the heart muscles contracting, and that pressure created by the heart then being transferred to different diameter arteries that are elastic, so they will push large amounts of blood through the system and down to these progressively smaller blood vessels, like capillaries, which are 1 cell thick. These capillaries can either be a continuous tube, or they can have these trap doors in them that will allow the blood to escape and drop off and stop by the liver, or stop by this patch of skin, or help nutrition absorption in the gut. Right? Hope you can imagine blood traveling down these arteries to various parts of the body and just hopping off when it needs to. The heart, 4 chambers, 2 atrioventricular valves. The right is the tricuspid, the left is the mitral. They have valve leaflets and chordae tendineae parachute cords, and papillary muscles that pull on them, and valves open and close by way of pressure. Right. The semilunar valves are going to go to the lungs. They're going to open the pathways to the lungs and to the system, respectively. So the pulmonary valve is going to be when the pressure in the right ventricle becomes so great that it's going to open up that valve and send blood into the lungs, where oxygen will hop on, carbon dioxide will jump off the taxi. Because that blood that has now been oxygenated is called oxyhemoglobin, right? An oxygen carrying compound on each red blood cell or erythrocyte. The heart, the bulk of it is created by way of this myocardium. It's a big muscle, cardiac muscle, shredded wheat looking histologically, multiple nuclei, intercalated discs, like little electrical cords that allow electrical contraction in one beat. The sinuatrial node is the pacemaker of the heart, which passes the relay to the AV node, sinuatrial to the AV node, to the bundle branches, to the Purkinje fibers. Primary function of the pericardium is to reduce friction, to allow an almost frictionless state of a constantly beating heart muscle. That's what I got. Best of luck, my friends.